This is not for kids.
When she moves shifts, something interesting happens. After Kristen joined the evening shift in early 1991, its death rate tripled compared to the 3 previous years.
Oh.
Damn. When she left, it dropped back down to pre-1988 levels.
Pre-Kristen levels.
Pre-Kristen levels.
What a coincidence.
For over 20 years, nurses have been rated the most trusted profession. But nurses are terrible people too. Join us for a discussion about nurse crimes hosted by nurses.
Welcome back to Nurses Are Terrible People Too. I am Nurse Dorothea. I almost forgot who I am.
It's that lack of calories in your brain, those sugars absent from your brain. There's only like 1 cup of broth in the last 24 hours or something.
Nurse Dorothea is on clear liquids for a colonoscopy, so it's rough over here today.
That's the problem with being a frappin' adult.
An old one.
An old adult. You have to get a fucking colonoscopy.
You got to do it.
And you got to shit your brains out for a day and a half. This is Nurse Ratchet.
And I'm Walt Whitman.
And together we have 69 years of nursing experience.
Bow chicka wow wow.
Today we are going to talk about Kristen Gilbert.
Kristen Gilbert? Isn't she like an actress on a show?
I don't think so. Kristen Bell. Kristen Wiig.
Gilbert. Who was on Roseanne? Gilbert.
Darlene.
Who is Darlene?
Kristen Gilbert.
Was her name Kristen?
No, I don't think it is.
Sarah Gilbert.
You're right. Sarah Gilbert. This is not a story about Sarah Gilbert.
Okay.
No.
This is a story about Kristen Gilbert, who is also known as the Angel of Death.
Oh, of course she is.
One of an ongoing series of the Angels of Death.
Can you get a better nickname?
Yeah.
Because all nurses who kill, they call them the Angel of Death because they think nurses are angels.
Right, but you know what? Actually, nurses are terrible people too.
Clearly. This might be a 2-part series. Kristen has gone down some roads.
Okay, let's hear it.
We'll start in her childhood. November 13th, 1967, Kristen Heather Strickland was born in Massachusetts in the suburb of Fall River. She's the eldest of 2 daughters of Richard and Claudia Strickland. Her dad was an electronics executive and her mother was a homemaker and a part-time teacher. As a preteen, she moved to Groton.
I'm sure it's pronounced Worcestershire or something.
With an accent, yeah. She was an honor student, and she babysat the neighbors' kids. She joined the math club. Was anybody a mathlete here?
No, I must have dysgraphia or something. My math brain doesn't work very well at all.
I don't love math, but I was on the science Olympiad.
Oh, yeah, well, that makes sense.
Nerd alert.
Back to Kristen.
She graduated high school in 1985 with some bangs. I made that up, but I'm sure she had bangs.
Oh, yeah, and a perm.
She graduated with honors a year and a half early.
Damn.
By all accounts, she seemed like a good kid. But post-criming, investigators looked into her past, and they found former boyfriends that reported that Kristen was allegedly a manipulator who was, quote, twisted but not stupid. She was prone to histrionics.
As you do as a teenager.
But she did have some more scary behavior, like tampering with their cars.
Oh,
Not cool, Kristen.
the danger zone.
Allegedly, she also attacked her boyfriends, clawing them, breaking the skin with her fingernails. Also post-criming, her father told psychiatrists that his daughter was a habitual liar who once convinced her college roommates that her mother was an abusive drunk, which was not true.
So rude.
A neighbor who lived across the street recalled that she lied a lot and would talk about having a connection with Lizzie Borden, who was a notorious Fall River native as well in the 1800s, who had been tried and acquitted of the axe murder of her father and stepmother, which I didn't know that Lizzie Borden was acquitted until I read this.
What about the poem? Lizzie Borden took an axe and gave her mother 40 whacks. And when something was done, she gave her father 40 what?
Apparently, that's alleged. So the girl that lived across the street was Kristen's friend at first, but she said her friendship waned as Kristen's lies and odd behavior increased.
Normal.
She said they used to watch General Hospital together, and Kristen told her that her favorite character was Amy, who was a conniving and backstabbing evil nurse. Kristen attended Bridgewater State College. While there, she began to experience psychiatric episodes in which she would make violent threats against others and herself. Court records reveal that when she was a student there, a former boyfriend said Kristen once left him a fake suicide note in which she claimed to have eaten glass. After this, school officials ordered her to undergo mental health treatment.
Thank you, school officials.
So she withdrew from Bridgewater State College and transferred to Mount Wachusett Community College and later to Greenfield Community College, where she studied nursing, and no one asked about her background. I mean, there is no background check for nursing school, so.
No? Oh, well, yes, there is.
To get into school?
If you're going to do any kind of clinical, we did.
It was so long ago, I have no recollection.
Yeah, no, I remember having to go in and do my fingerprints and stuff.
Really?
I think I had my fingerprints done too. Never mind. There probably was a background check.
Yeah.
Did you have to pee in a cup too?
No, because I would not have passed.
I think we did.
Really?
Yeah.
What state were you in?
Wyoming.
During school, Kristen got a job as a home health aide, and she was assigned to bathe a young child that had severe cognitive disabilities. The child ended up with burns over 60% of their body, scalded from hot bath water.
That's ridiculous.
It really is.
She was not prosecuted for this.
It was just a simple mistake.
Well, it could have been.
Yeah.
People do
Yeah.
not check the bathwater sometimes, and it could have been a mistake.
Sometimes they throw the baby out with the bathwater.
She earned her degree in 1988 and began working at the Veteran Affairs Medical Center. She began her career in Building 1 in the main medical unit on day shift, which is weird.
Ew, day shift.
You don't normally start on day shift, but she did. In 1988, it was a big year for her. She not only graduated nursing school, she also married Glenn Gilbert.
Sorry, Glenn.
Glenn worked for an optical lens firm. Glenn and Kristen bought a ranch-style home in the Florence section of Northampton. Kristen was really well liked at work. She did all the Stepford nurse things. She was a can-do, take-charge nurse. She always made sure that they had a Secret Santa exchange at Christmas. She coordinated gift drives for needy families. She ran the Sunshine Fund, which, for the listener, if you don't know what the Sunshine Fund is, it's a fund to support your coworkers when they have a death in the family or a baby shower or a wedding. And Sunshine Funds are nurses supporting nurses with zero help from their employer.
Like normal.
That's what we always do. She was your ideal nurse so far. Her supervisor said she had excellent clinical skills, especially in medical emergencies, and she was routinely assigned to the ICU. She was even featured in the VA Practitioner magazine in April of 1990.
Collector's item.
She was commended by her coworkers as a calm and confident person during emergencies. She was often there for patient codes, and she got a reputation among the doctors and nurses jokingly being the angel of death. Because nurses like to joke.
Everybody has a dark sense of humor.
But you have people at work that you say have a black cloud, right? That's a nursing thing. You know, so-and-so's in charge tonight. It's going to be a busy night or a terrible night because they have a black cloud.
We're going to get 5 admits and they're all going to be crashing.
Yeah.
SB looking at you.
Exactly. Exactly. Nurses tend to be, as Michael Scott would say, not just a little stitious, but superstitious. What are some other superstitions that nurses have?
Definitely don't say quiet at night.
Or anytime.
Right now, saying it in my own home, I'm still like a little bit nervous saying the Q word.
Yeah.
Because it'll fuck shit up.
Yeah, I was surprised you didn't just say, don't say the Q word.
Well, I had to let the listeners know what the Q word
Well,
is.
that's true. There's don't leave the pillow off the bed when making the bed in a room.
What? Why?
Because if the room isn't completely ready, you will get a patient.
Oh, right.
Oh.
If you leave one aspect of making the room ready off, like you don't put the cart in the room or whatever, you will get a patient.
Dude, last night I got all the things ready for this transfer and they were really super sick. I got all the pressers. I had all my pumps ready, at the vent ready, everything ready. And they fucking died in the flight over.
Oh, that does not happen that often.
I know.
That's super rare. Oh, that's sad.
But I was ready.
But you were ready, so she didn't come.
That's right.
See, it worked. There's also a full moon or Friday the 13th.
Oh, yeah.
Full moon is,
It's a real thing.
it is a real thing. There is putting the code cart outside of the room
Oh, yeah.
to ward off
Yeah.
evil spirit.
Oh, yeah. It's a good move.
Yeah, which for the listener, the code cart is the big toolbox you go get when somebody's crashing. So if you take it and you put it outside of their room, then they won't code. That's the lore.
Again, if you're super, super ready, then it's not going to happen.
There's also unlucky rooms, which everybody knows.
Yeah.
Oh man, they're going in 505, not making it out. How about if you have a potluck that night, you're going to have a crazy night.
I hate that. Christmas potlucks.
Yeah.
When it's like horrible, no one gets to have like their
Notorious.
fucking waffles. And then don't say a certain frequent flyer patient's name because that clues in the universe to bring back that patient to your unit.
Yeah, if you say a frequent flyer's name, they will be in the ER and they will be in your unit.
Within 8 hours.
For sure. There's also the Jesus bus keeps coming by until they have 3 riders at a time.
Oh, that's very true.
It's true. It happened last night. One of them was in the air, so they didn't actually ever get to us, but 2 other people did also go into the Jesus bus.
But that's 3. It counts. Some nurses just are unlucky, which is absolutely true. Other nurses have an advanced set of skills that make them interact more with an ill population, and therefore they are in more emergent situations. Mm-hmm. If you were assigned to the ICU more often, you're going to be at more codes, you're going to be at more deaths. That's just the way it is. It's not weird for your coworkers to call you an angel of death, actually. It's not out of the realm of normal if you happen to be around a lot of the codes. She switched the night shift, and then her first son was born. Upon return from maternity leave, she was permanently assigned to the 4 p.m. to midnight evening shift. I do love an evening shift, but not 5 days a week. Like, that's not going to work. But
you know what's good? 410s.
410s is great. 312s is awesome.
312s is perfect.
312s is exhausting.
It's perfect, though.
November 13th, 1993. Her second son was born on Kristen's birthday.
Happy birthday, birthday.
You know, the Sunshine Fund was all over that.
Oh, yeah.
Yeah.
2 for 1. BOGO.
So far, it seems pretty good, right?
Yeah. Mm-hmm.
She's doing her thing. She's working hard. She's being the Stepford nurse. Mm-hmm. Well, when she moves shifts, something interesting happens. After Kristen joined the evening shift in early 1991, its death rate tripled compared to the 3 previous years. That seems very statistically significant. When she left, it dropped back down to pre-1988 levels.
Pre-Kristen levels.
Pre-Kristen levels.
What a coincidence.
Simultaneous to all these shift changes, James Perrault, who was a Persian Gulf War veteran, was hired at the hospital as a security guard. As James would do his rounds, he started flirting with Kristen.
As you do.
You don't flirt with the security guards at work.
I don't know. They know where all the good potlucks are.
They do.
Yeah.
He starts flirting with Kristen, and in August 1995, James and Kristen and some other coworkers start having liver rounds at the VFW after work because you can get a 20-ounce draft for $1.50.
I love the VFW. It's legit.
For the listeners, liver rounds is where you go out with your coworkers after your shift, which is usually night shift or evening shift. I mean, you could do it for day shift too. Really, after whatever shift, you go out with your coworkers and you drink.
After work.
Yeah.
Drink, drink, drink.
You drink, you decompress, you talk, you get kicked out of a few morning breakfast restaurants, but whatever.
You guys are out of here. You're bothering the other patrons.
You're serving alcohol at 7 o'clock in the morning. Who's at fault?
Yeah, this is on you.
Come on.
Come on, don't deflect.
Kristen shared with James that her 7-year marriage was on the rocks, and they started emailing each other seductive and funny emails.
God, I love this. So 1990s.
This escalated to a full extramarital affair. During this time, Kristen's husband noticed that she was doing a lot more home cooking.
Oh.
But the food started to taste a little funny.
She was totally poisoning him.
Allegedly.
Allegedly.
Don't sue us, Kristen Gilbert.
On November 5th, 1995, after feeling sick all day, Glenn became violently ill, and Kristen drove him to the emergency room at the Cooley-Dixon Hospital, not the hospital that she works at. He was diagnosed with low potassium and low glucose levels. They fixed him right up, sent him home. A week later, Kristen came home during her dinner break. Red flag number 1, how do you have a dinner break? Number 2, why are you going home? Number 3, she says she's unsatisfied with the care that Glenn received at the hospital. This is a week later. If you're really that unsatisfied, you would have waited a week, whatever. Okay. She was going to draw his blood herself, take it to her hospital, and have it run.
It doesn't make any sense.
It doesn't, unless they have a point of care tester on the unit. The little one, you just put the blood in and it reads out your electrolytes.
Yep.
Yeah. That is a possibility. She could have done it at work. It's not totally out of the realm of possibility, but that having a dinner break is. They went into the bathroom where Kristen was going to draw the blood. She removed 2 syringes from her canvas bag, which I don't know why, but a canvas bag seems like sus. It looks murdery. Also, where did I find this detail? I don't know. I went down a huge rabbit hole.
Yeah.
Multiple nights of fixation. Thanks, ADHD.
Thank you.
One needle was filled with a clear, odorless liquid. Kristen said it was saline. She wrapped a tourniquet around his arm, and she told him she was going to flush his vein before drawing blood.
Never happens. Don't need it. Why would you do that?
You would not.
Never.
Exactly.
Never.
You do not flush your vein before you draw blood.
In fact, that would be really dumb.
Yeah. She was banking on Glenn's lack of medical knowledge.
After the needle went in, his arm grew cold. The color drained from his arms and chest, and he tried to pull away and asked her to stop. Now, instead, he later testified that his wife pinned him against the wall with her hip and sped up the injection. He lost consciousness and slid to the floor.
Sketch.
When he woke up moments later, his wife said he had fainted at the sight of the needle, which, let's be honest, it does happen, especially with large white men.
Oh, yeah, totally.
Yeah.
Or especially large white tattooed men.
Mm-hmm.
I'm scared of needles.
Very common.
He's got his skull tattooed.
Yeah, he does.
Exactly. She appeared flustered, and she put the syringes back in the bag and said, "This isn't going to work."
This murder is not working out for me.
Allegedly. Don't you think it's really weird that she chose the bathroom to, quote, draw blood in? Why would you choose the bathroom to draw blood in? If you wanted to draw blood on somebody, you would want it to be in a clean environment. So the only reason you're going to choose a bathroom is if you have an ulterior motive.
To stage the scene.
Or maybe she chose the smallest room in the house so that there was less likely chance of somebody actually saving him.
Or maybe she was hoping he would fall and hit his head, and it might be staged to look like a shower fall.
I think that she did it on purpose because she wanted him to die in the bathroom so that people would assume it was a commode code.
Commode code!
What's a commode code?
A commode code is when someone is straining to use the bathroom. This can cause you to stimulate your vagus nerve. By doing that, you can cause severe bradycardia, which is a very slow heart rate, or an arrhythmia, which means your heart is not pumping appropriately the way it is supposed to. It can cause a loss of blood pressure. And when your pump isn't pumping, the rest of your body isn't getting all of the blood and oxygen it needs. Things like your brain don't work so well, and you can pass out. If you do pass out, you could hit your head on the floor. That's a problem. It can cause you to have a cardiac arrest. Alternatively, straining can lead to an increase in blood pressure, which can cause a stroke, or it could cause an aneurysm to burst. So there's a lot of reasons for people to die on the toilet.
And she would know this as a nurse.
She would know that, and she would know that if you are allegedly injecting epinephrine, you are causing a cardiac event, and a lot of cardiac events happen in the bathroom. So if a medical examiner came out and saw this guy died in the bathroom and it seems like a cardiac event, they may not question.
She was so sneaky. That's how Elvis died.
Yeah, Elvis was a commode code. Glenn did not mention this incident to anyone until months later amid a custody battle.
Oh.
Which I hope he won that.
God, I would be so calling the cops.
If you trusted your wife and you thought, oh, she's really just drawing my blood to see if I'm okay because she cares about me so much.
Ooh, man, that is some deep level manipulation.
Yeah. Kristen's lawyers say it definitely could not have been attempted murder because when he slumped to the floor, she did not murder him. Some good lawyering right there. It cannot be attempted murder if you didn't murder.
So technically it wasn't murder or attempted murder because I didn't finish the job.
You can't attempt it if it's not murder.
Wow.
According to her lawyers.
Wow. And now a word from our alleged sponsors.
Kidney disease and feline homelessness are both on the rise. Our researchers have made a breakthrough that will revolutionize kidney dialysis and find cats their forever homes. Introducing Dialicat. Dialicat is a rescue feline genetically modified to be perfectly compatible with its new owner. Dialicats feature hypodermic needle claws that easily attach to a patient, which then filter their blood, removing harmful toxins. A patient will only be required to have the Dialicat sit on their lap and then pet it for the entirety of the treatment. Every Dialicat comes with yarn, extra-large biohazard-grade litter box, electrolyte replacements, and catnip. Gone are the days where you have to go to the dialysis center 3 times a week. Instead, simply stay at home and cuddle your Dialicat.
Dialicat, from the makers of Transformers. During this time, she told Security James that she was being abused at home. This caused James to give Kristen an ultimatum. You leave him or I'm going to leave you. So Kristen walks over to the payphone and she tells Glenn that it's over. And then 1 week later, she and her kids move into an apartment near Security James's place and she gives him a key to her apartment. Now it's 1995 and back at work, 26-year-old Kristen is still working evenings, still at the VA, sometimes in acute care, but often in a 4-bed ICU ward in Ward C. In late July, there was an incident involving Kristen. There's a patient named Stanley. He was a 66-year-old male, admitted for a post-op bowel obstruction, and he was doing so well, he was expected to move to the nursing home the next day. A couple of different LPNs had been in to check on him that evening, and then Kristen went into his room with a syringe of fluid and an alcohol swab. She claimed she was going to flush his IVs to make sure they kept working, which is absolutely a thing. You have to flush them once a shift to keep them patent and working properly.
Totally normal.
So now we have pre-filled saline syringes. They come from the manufacturer. It says what it is, and it has an expiration date, and it has saline in it. But back in the day, I remember in nursing school, nurses would have to draw up their own saline flushes from a liter bag of saline.
I remember that too.
One of the nurses would make a bunch for the entire shift.
Here, I'm making a bunch of salines for you all. And some of them have insulin and potassium in it.
They weren't always labeled. Nobody was labeling and dating all of those syringes.
Nope.
It would be very plausible that she had a syringe of fluid that she says is saline, because that's normal. But what is not normal, while she was in the room, the other nurses heard the patient yell, "Ow, it hurts, you're killing me."
Be dramatic, why don't you?
But some people are dramatic.
Yeah. Sometimes when you've got an IV that's been there for a while, probably on its last leg, when you flush it, they'll be like, "Ow, that hurts."
Totally.
Especially when you first flush it.
There's like a little bit of blood around the end of the catheter. Totally normal. So sometimes it does hurt.
Yeah.
Ow, you're killing me is a little bit extreme, but that's okay.
So 3 minutes later, he has a cardiac arrest, and 3 hours later, he died. Coworkers didn't bring up this event to anyone because people sometimes are dramatic. Like, that happens. They say, "Oh, you're killing me." Who among us has not been accused of killing somebody?
Oh, totally.
Yeah.
Or kidnapping them. I've been accused of kidnapping them multiple times.
Tying them down. Yeah.
I'm going to call the police. You kidnapped me and are tying me down. Give me that phone.
Yeah. Especially in the ICU, when people are there for a while, they get ICU delirium and they don't even know they're in the hospital. So anything you're doing to them seems a little weird and they're suspicious. So it's not out of the realm of possibility, which is, I think, why her coworkers didn't bring up this event.
It sure is sus, though.
But at the time, I don't know that you would think it was.
I guess hindsight is 20/20.
Yeah. Another patient, Henry, he was kind of the perfect victim because he was a veteran who had some unfortunate life events, such as a brawl at a pizza shop that left him in a coma for 3 weeks. He suffered multiple mental illnesses and he heard voices, and he was a frequent flyer at the VA. As soon as he would get on some meds that worked for him, he would discharge, and then he would go home and stop taking his meds, spiral down, get readmitted, back on the meds, rinse, repeat. On December 7th, 1995, Henry left AMA, which is against medical advice. Though he was feeling well mentally, he had a pretty bad case of the flu, so his mother brought him back to the VA for care. This time, instead of being readmitted to the psych ward, he was admitted to the medical ward, and it happened to be Kristen's medical ward. Henry pleaded with his family. He said, "You can't leave me here. You can't leave me in this building. People are dying around here for no reason." And when his mother asked him why he was so afraid, he said, "The patients are talking about it. The staff is talking about it. The staff is talking to the patients about it. But no one really believed him because he was frequently delusional. He also told his mother, "I'm not a nut. I'm your son. Can't you believe me just this one time? I don't want to die here. The VA will own my soul." Which sounds like crazy people talk.
It does.
If you have a history of mental illness and you are often delusional, they may just be like,
Yep, get back on your meds.
"Okay, honey."
I hear you.
His mom left at 4:45 p.m. Kristen had been on duty for 45 minutes. His mom never saw her son again.
Oh.
At 5:48, he had a cardiac arrest.
Oh.
People who are gonna die often do tell you, "I'm gonna die."
That's true too.
That's very true.
It's usually the patients who say it very calmly. If you have a patient who is freaking out and saying, I'm gonna die, they're probably not gonna die. It's the people who say it creepily calm.
Yeah. Like, call my son. I'd like to speak to him before I die.
My patient 2 nights ago said, "I'm going to die in 24 minutes. He did not die the whole night.
Okay, so it's not 100%. But you've had patients who told you they're going to die.
Oh, yeah.
And then they did.
Oh, yeah.
A patient named Kenneth had been hospitalized for late-stage multiple sclerosis when he had come down with a fever. He had a month-long hospitalization, but the doctors told his wife he was getting better. He died on February 2nd, 1996, after going into cardiac arrest under Kristen's care. Next patient we have is Edward. He was a dedicated World War II veteran who was hospitalized for chronic alcoholism in early February 1996. He was admitted to an inpatient substance abuse treatment clinic in Worcester, Massachusetts for treatment. But on February 15th, he was transferred back to the VA and placed in Ward C, where Kristen was working.
C team.
The same day, he suffered a catastrophic cardiac event, and he was transferred for tests to another medical center in Springfield, Massachusetts. This is a thing that does happen. If your hospital doesn't have appropriate testing capability, you make a deal with another hospital and you say, "Hey, can this person come over and get this scan or this ultrasound or whatever your hospital is lacking?" And the deal is you have to take them back. You can send them out to go get that test if it's really needed, but then they send them back. So he went to this other place to get a test done in Springfield, where the Simpsons live. The doctors at the other facility told his family that he was dying of natural causes, including a heart attack and dissecting aneurysm, and that no medical or surgical intervention would save him. He was returned to the VA. He died there on February 18th. Immediate causes of death were listed on his death certificate as dissecting aneurysm, inferior wall myocardial infarction, and arrhythmia. No autopsy was done because it sounds
legit.
reasonable.
Yeah. He was probably elderly. He was World War II. Yep. With alcohol history.
Yeah. As nursing staff became more and more suspicious of their colleague, they began paying more attention to what she was doing on her shifts. When she came to work the day that Edward's heart stopped, Kathy Ricks, another nurse who suspected Kristen of harming patients, had checked the ICU's medicine cabinet and counted 3 ampules of epinephrine. After the cardiac arrest, the 3 ampules were gone.
Oh.
They opened the sharps box and found 3 ampules of epinephrine in the sharps box.
Ruh-roh.
No epinephrine was charted as used during the cardiac arrest, because that is a thing.
Yeah.
Right.
Epinephrine is an old drug. It's been used for a very long time, but it's usually used in a code situation or an emergent situation where someone is crashing, having significant difficulties, or it's used to treat anaphylaxis, which is your throat closing up from a severe allergic reaction. Either of those situations are emergent situations. The only non-emergent situation where you would use epinephrine would be an epinephrine drip, which we don't use very much.
Which is still for cardiac arrhythmias.
Yeah.
It's not very often, but back then you may have used it more. I don't know. You know, drugs come in and out of fashion. And the only time I could possibly think of just having random epinephrine vials is if you were making your own epinephrine drip.
Right.
Which now we don't do that. The pharmacy makes it. In the old days, they did mix their own drips.
Back in my day, we used to make our own drips.
But he was not on an epinephrine drip. Basically, if you see epinephrine has been used, you come on shift and you see the epinephrine is out, you know that the shit has hit the fan in some way.
Yeah.
It's not good. More of the nursing staff became suspicious of their colleague, and they began paying more attention to what she was doing on her shifts as well. So the thing about epinephrine is that you give it and it works really quickly, but then it wears off as well. So say you have an allergic reaction, you give epinephrine, you can't just be like, yeah, and we're good now. It's going to wear off and you may have to give it again. It works very quickly, but it wears off very quickly. Other effects of epinephrine: tachycardia, high heart rate, high blood pressure, arrhythmias, which is messing up your electrical
heart rhythm,
beats by Dre.
Beats by Dre.
But it can also cause flash pulmonary edema, which is your lungs filling with
fluid.
The other thing it causes is poor cerebral perfusion. Epinephrine makes your blood vessels squeeze tighter. That's how we use it to make your blood pressure go up, is we squeeze your blood vessels with it. But if you squeeze your blood vessels that are going to your brain a little too tight, a little too fast, a little too furious, you don't have blood flowing to your brain.
Which I hear is not ideal.
It is not ideal. You might want to ask Glenn.
You might lose consciousness. You might just slide right down a wall.
But then you might come to pretty quick because it wears off.
I'm just flushing your vein, Glenn.
Just flushing. It's fine. 2 days after Edward's death, another patient comes in who has HIV. He's admitted for simple antibiotic treatment. People with HIV may have a decreased immune system. Often they get secondary infections and you need some antibiotics for that, especially back then before we got all of our lovely fancy HIV drugs that we have today. Now, not so often, as long as you're staying on your meds. It's not as big of a deal, but back then it was a little bigger deal. He was supposed to get his antibiotic treatment, but he became nauseous and felt a burning sensation and passed out after Kristen flushed his IV line.
This is getting to be quite a coincidence.
Her colleagues had enough and reported their suspicions, and a formal investigation began. Suspiciously, Kristen immediately left.
Of course she did.
She filed for workman's comp for a shoulder injury.
Oh, no, come on.
Yeah, she did. Which, let's be honest, when you work in an ICU, anyone could go out at any time. You have a back problem if you work in the ICU.
Oh, yeah.
Just baseline, you have a back problem. And that's from lifting, moving.
And a front problem, and a side problem, and a top problem, and a bottom problem.
And a foot problem, and an ass problem, and a mental health problem.
You get a lot of problems.
Every problem. Pick a problem.
Yeah, so if you need to go out on workman's comp, that's very possible to do. Soon the investigation was leaked to the press, so Kristen was able to follow along with the news reports regarding the investigation, and she still had a mole on the inside. Security James.
Get it, girl. Get it.
James was emailing her updates and all the hot goss.
God, I love 90s. Just email.
He's just sitting at the security desk emailing her.
He's like, can I use the computer, the one computer with the internet?
Yeah.
And then it goes... You've got mail. He says at the time he believed Kristen was innocent and he wanted to help her out. So he kept telling her what was going on at the hospital. Kristen was interviewed by investigators from the VA Office of Healthcare Inspection. They came from Washington, D.C.
Bigwigs.
Yeah, that was in March of 1996, and they asked her straight up why so many of her patients had died and why she happened to be there for so many emergent events. Kristen told them there's a very simple explanation for this. She said that when it came to patients in trouble, her medical intuition is especially fine-tuned.
Right.
And she also told them because codes come in spurts. But they do.
They come in spurts when I'm around.
Yeah. And she said that her presence for so many codes was merely a coincidence and that her numbers are artificially inflated because the LPNs and the nursing assistants looked up to her as best in codes. Best in codes.
We're going to get you a ribbon. It's going to be red and it's going to say best in codes. No, it should be blue. It should be a blue, code blue ribbon.
A code blue.
Best in codes.
You know, if you go to her house, she has code blue ribbons all over the top of her bedroom wall.
That's right. Above the mirror.
Because she is best in codes. But let's be honest, though. There are some nurses who are better at seeing codes coming.
Absolutely.
Nursing intuition, yeah.
I mean, there was this one nurse who had worked on our unit since I was born. And she could literally walk by your room and say, you need to draw an ABG on your patient. You need to do it now. And she was always right.
Yeah.
She could just look at them and tell that they were acidotic. As you're a nurse for more years, you get what we call your spidey senses.
Yeah.
Where you can just look at a patient and say, you look sick or not sick. You know, you look sick and maybe I don't know exactly what's wrong with you, but I know there's something wrong.
Mm-hmm. Yeah, it's totally true.
That is a thing. And looking for a nursier nurse is also a thing.
Yeah.
Right. Mm-hmm. You got to find your people.
If my patient is going down the tubes, I'm going to be like, hey, old nurse. Or what did our friend the other day say?
Oh, so a patient was doing bad. And so one of the experienced nurses said to the other nurse, go get me another nurse. Anybody not in joggers. Not in joggers.
Someone who looks like they don't care about their appearance.
That is incredible.
And they did. They went and got the nurse who didn't have joggers on, and she has over 20 years of experience. And she went and helped. So it is a thing. Find me a nurse without makeup. Stat.
Hair's a mess. Get her.
These things aren't completely out of left field, that she's giving these as an excuse. It sounds really stupid, but these things do happen. In the 7 years she had worked at the hospital, which is March 1989 to February 1996, authorities say Kristen was on duty for about half of the 350 deaths that occurred on her ward.
That's a lot.
Wow. Considering she's only there a quarter of the time.
Less than a quarter because there's days she has off.
Yeah.
Well, a third, but if she worked every day, it would be a third.
20 to 25%. That's wild.
Yeah.
That is wild.
The prosecution did a statistical study that said the odds that she attended so many deaths simply by chance is 1 in 100 million.
Wow.
Please join us next week for the remainder of the story of Kristen Gilbert. It only gets worse. You are not going to believe how bad it gets.
And now, to restore your faith in nurses.
Karen Mott, an oncology nurse in Massachusetts, adopted her dying patient's 9-year-old son when there were no other family members to care for him after the patient's death.
Thanks for hanging out with us for The Shift.
In lieu of a Press Ganey survey, please leave us a 5-star review.
We are at Terrible Nurses Pod on Instagram and TikTok as long as it lasts.
Email us at terriblenursespod@gmail.com.
This podcast is for entertainment purposes only.
Poor Elvis faked his own death just so he could live out his life as a normal person. According to the Weekly World News, we still haven't found him.
I saw him in Las Vegas.